Hello and welcome to Force's July Hereditary Cancer Live Update. Our live updates are meant to deliver news designed to keep you informed, empowered, and engaged. The updates given today are paramount to our community. My name is Elise Boucher. I'm a member of the Force community and I will be your moderator. Force improves the lives of millions of individuals and families facing hereditary breast, ovarian, pancreatic, prostate, colorectal, and endometrial cancers. Our community includes people with a BRCA, ATM, PALB2, CHEK2, or other inherited gene mutations, and those diagnosed with Lynch syndrome. We accomplish the Force mission through our support, advocacy, education, and research efforts. Visit our website for expert-reviewed information and access to our support programs, including virtual Zoom meetings, our peer navigation matching program, and our online message boards. At this time, we would like to recognize our sponsors for making this programming possible and for their continued support of Force and the hereditary cancer community. Our Force presenters today are Kelly Owens, Director of Education and Research, Piri Welsh, Vice President of Education, Lisa Schlager, Vice President of Public Policy, and Sue Friedman, Executive Director and Founder of Force. After their updates, we will conduct a Q&A to answer the many questions that you have. Please submit your questions using the Q&A feature. We will do our best to address each one. Our presenters will not be providing medical advice. Please reach out to your doctors if you have any specific or urgent questions. At this time, I would like to welcome Kelly Owens, Force Director of Education and Research, to present.
Thank you. I work with our X-ray program, which summarizes current cancer research in plain language. And the QR code that you can see in the upper portion of this slide will take you to our library of over 360 different X-ray reviews. Today, I want to highlight just 3 of those that are focused on hereditary cancer and that have come out recently. So the first is on pancreatic cancer. And this is a review that summarizes a study of pancreatic cancer patients who are Hispanic and looks at the chance of them having hereditary cancer. What was found in the study is that nearly 16% of people with pancreatic cancer in this community have a mutation in one of the common known cancer genes, including BRCA2 and PALB2. But what was interesting about this was that some mutations that are maybe less common in different populations, ATM and CDKN2A, were the most frequent in this population. So this is by way of saying, if you have pancreatic cancer, genetic testing is recommended in the US. It does not always happen in Mexico, where the patients in this study were because of access issues, but is an important piece of understanding the best treatment for pancreatic cancer. The second review is on colorectal cancer, and in particular looked at people with either metastatic colorectal cancer or colorectal cancer that couldn't be removed surgically, and showed that a new drug combination of Opdivo and Yervoy, 2 immunotherapy drugs, really benefited individuals that had MSI-high tumor cancers. So MSI-high is a tumor marker that is common in individuals with Lynch syndrome. And so it suggests that this new combination may also be beneficial for people with Lynch syndrome. And it showed nearly a 3-year improvement in how long it was before people progressed with this kind of cancer. So it's a really promising treatment. The third review that I'd like to mention is on multiple myeloma. This is a very rare cancer. It's a type of blood cancer that affects plasma cells. And this study looked at how frequently hereditary cancer was among multiple myeloma patients. And what they found was, like with many cancers, about 10% of people with this cancer had mutations in a gene linked to some other hereditary cancer. And this included BRCA1 and 2, ATM, and CHEK2. Now, I want to emphasize that this is a very rare cancer. We do not see this kind of cancer commonly in families with BRCA1 and 2, for example, but it is possible that there's a increased risk of this cancer. What's most relevant to people, I think, is if you're diagnosed with multiple myeloma and you have a mutation in a hereditary cancer gene, there may be some additional treatment options that are available, and people with hereditary mutations tend to respond better to those treatments. So on the next slide, I'm sorry. On the next slide, I want to highlight just an additional X-ray that has come out recently that looked at breast implant associated anaplastic large cell lymphoma and people with BRCA mutations. So this is a cancer that can occur. It's not breast cancer, it's a lymphoma, so cancer of the immune system that's very rare. It occurs in the general population in about 4 in 10,000 people at most, and in many studies, quite a bit less than that. It has been linked to textured implants, breast implants. Predominantly, there have been a few cases with smooth implants. Almost all the cases were with textured implants, and in particular. So the particular study that we looked at here looked at whether this rate was more frequent among women with BRCA1 and 2. There had been some hints in an older study that might be the case, and they did see a slight increase among individuals with BRCA1 and 2 mutations. But I want to emphasize here that this is a very rare cancer. 99% of people with these textured implants, with or without a mutation, do not have a problem, but there may be a slight elevation among individuals. This is rare enough that it's not recommended that people remove implants if it's not a time when you would normally do that. But I will note that the FDA has said that breast implants are not a lifetime device. They're considered something that is temporary, and that most providers recommend replacing any kind of breast implant within 10 or 15 years, mostly due to the risk of rupture and other types of effects, but it would, yeah. So I will leave that here and give control of the presentation back to our moderator. Thank you.
Excellent. Thank you so much, Kelly. Next, I would like to welcome Piri, our Vice President of Education.
I'm going to switch gears a little bit here and introduce you to a new blog series we recently launched called Keeping Up with Hereditary Cancer Genes. And there are a number of,
Sorry, I'll take you back, Piri.
Yeah. There are a number of reasons that we decided that this series would be a worthwhile project for us. FORCE currently covers 24 hereditary cancer genes in depth on our website. However, we know now that there are many more than 24 hereditary cancer genes. And I think with the advent and now almost routine use of multi-gene panel tests, people are often being told they may have an inherited mutation in a gene they've never heard of. So I often will get questions, is this, I have a mutation in this gene, is this going to increase my risk of hereditary cancers? Also, with the advent of multi-gene panel testing, people are being told that they have a mutation that may not be in their family. So I have a story of one woman who was sure when she had multi-gene panel testing, she was going to have a mutation in the Lynch syndrome gene that was on her father's side of the family. However, it turns out she didn't have this gene, a mutation in the Lynch syndrome gene. She had a mutation in BRCA2. So multi-gene panel testing is going to reveal more and more hereditary cancer genes and their mutations. So this series is designed to keep up with the landscape of hereditary cancer genes and its evolution. So I'll take you through one mutation that we just published. This is a blog about a gene called SMAD4, which works to turn off and on genes. So you can imagine if this gene is not working correctly, it might turn the wrong genes or the right genes off and the wrong genes are on. SMAD4, people with SMAD4 mutations are at increased risk for colon cancer and stomach cancer. And there are some guidelines, and you can see here, guidelines suggest that colon cancer screening begin at 18, as well as stomach cancer, so much younger than routine screening for the general population. And I love doing these because I also learn things myself. And what I learned here under other considerations is that people with a SMAD4 mutation sometimes can have a hemorrhagic disease, or a disease of the blood vessels. And this can result in chronic bleeding and hemorrhage if not addressed. So if a family has a known SMAD4 mutation, that it is recommended that new children in that family, new children born into that family, be tested for that family's SMAD4 mutation within the first 6 months of life due to the increased risk of this hemorrhagic disease. So I encourage you to take a look at these. If you have any questions about genes or would like to see a gene covered in this blog series, you can just text or email info@facingourrisk.org, and I'll be happy to include those new genes in this series. Eventually, these genes will be moved on to our website. And with that, that ends our education update.
Excellent. Thank you so much, Piri. Next, I would like to welcome Lisa Schrager, our Force Vice President of Public Policy.
Thanks, Elise, and thank you, Piri and Kelly, for that great information. We are now pivoting to some exciting stuff that's happening in the public policy and advocacy world. First and foremost, as we've shared previously, Force has gotten heavily involved in state public policy efforts over the past few years. And as many state legislative sessions are winding up, we're excited to share that we've succeeded so far this year in passing 16 new state laws. And you can see here the different subject areas that they are in. They cover things like genetic testing, so multi-gene panel genetic testing and all the associated high-risk cancer screenings, as well as supplemental breast or prostate screenings, fertility services, and more. And for the screenings, the majority of these are without patient cost sharing, meaning that you will have no copay and no deductible when you go in for these services. So very exciting, and we will be sharing additional wins as the year progresses. Next, we have something exciting that has passed at the federal level. The Orphan Cures Act passed as part of the recent reconciliation package that was considered and passed through Congress. And while that particular package had a number of things that are concerning to our community, this is absolutely a positive, a shining light in that bigger scheme of things. This particular bill fixed something that unfortunately undermined the incentives to develop orphan drugs or cancer and other rare disease treatments for populations of under 200,000 people. And ultimately, the Orphan Cures Act fixes that problem and returns us to where we were a couple of years ago, and completely benefiting from the Orphan Drug Act, which was passed in 1983. For our community, this is extremely important because PARP inhibitors, which are shown to be exceptionally effective in people with BRCA genetic mutations, were in fact initially used as orphan therapies to treat BRCA-positive ovarian cancer and pancreatic cancer before they moved on to be treatments for bigger populations. So we're excited to see this, and we think it will help facilitate additional research and hopefully new treatments for people in our community with other types of mutations. Force held its Advocacy Day, our fourth one, on June gosh, it was June 12th, I believe. And we had our most successful event yet this year, or not this year, but since we've started our advocacy days. You can see here we had a couple of items that we prioritized. One was the Access to Breast Cancer Diagnosis Act, which is a federal bill that would eliminate the out-of-pocket costs that patients face for their supplemental and high-risk breast screenings. We also asked our advocates to help us oppose the Patent Eligibility Restoration Act, which would allow for the patenting of DNA and other products of nature again. We are very concerned by this piece of legislation. And then we had our advocates talk about things that were more personal to them, such as cuts to the NIH or CDC, Medicaid, and so forth. You can see here the numbers of people that participated and the number of meetings that we had with the lawmakers and their staff. And if you weren't able to join us, we hope that you will have the opportunity next year as the event is virtual, so you can do it from anywhere around the country. Keep your eyes open and check our website for more information on the 2026 event. And finally, to build on the concept of the cuts and the layoffs and the restructuring and its impact on our community as well as many other communities around the US. I just wanted to mention that these are absolutely areas of concern for Force and for our community. We know, for instance, that the proposed cuts to NIH will result in nearly a 40% budget decrease, which ultimately will lead to canceled research projects and clinical trials being halted, which is a big deal for cancer research and other types of research. We also know that there are significant cuts proposed to Medicaid, which will ultimately harm people who are already vulnerable, many people with disabilities and children. So that's a big concern because Medicaid is crucial in providing health insurance to children and families who otherwise would not be able to afford health insurance. And finally, the cuts to the CDC. Currently, the proposal for the Centers of Disease Control is a 53% cut in budget, which is absolutely significant. And of major concern to the cancer community would be the elimination of the colorectal cancer control program, the National Breast and Cervical Early Detection Program, and the National Comprehensive Cancer Control Program. Importantly, I'd like to mention that Force and other organizations that we partner with are recipients of grants from that agency, from the CDC, and it will ultimately have a long-term impact on the communities that we serve. So we would like to encourage you to go to our website here where you can take action and you can click on an issue that is of importance to you. And there's already a pre-written email that you can personalize if you like and send it directly to your member of Congress and your senators. There are a number of issue alerts there, so we encourage you to take a look and to check back often as we are continually updating our action alerts and encouraging our community to reach out to share their stories and how these different issues may impact you or the people you love and work with. So that's it for me. I will pass it back to Elise, and thank you again.
Excellent. Thank you so much, Lisa. Next, I would like to introduce Sue Frieben, Executive Director and founder of Force.
Thank you so much, Elise, and incredible, such important information. And Lisa, I'm so glad that you talked about the potential impact on research. Obviously, research is near and dear to our heart and really the focus of some of the things that I'm going to talk about now. So on the screen, you see the two major guidelines for hereditary cancer from the National Comprehensive Cancer Network. And so many of you may have seen these guidelines. And if you haven't seen these guidelines, you've probably seen some rendition of the information in these guidelines. Those of us with inherited mutations, caregivers, healthcare professionals, we rely on these guidelines for the most up-to-date information so that we can make good decisions about what we want to do about our health and care. And these guidelines are updated annually based on the latest research. So without this research, we wouldn't have these guidelines. Let's see if I can get it to advance. There we go. You may recall last year that we launched a couple of surveys for the high-risk community. They were pretty long surveys. Hopefully, many of you completed the surveys. And this is what you told us with regard to participation and interest in research. So the pie chart on the left was an answer. So over 1,000 people responded to these surveys, actually over 1,500 for some of the questions. We asked you, has a healthcare provider ever spoken to you about participating in research related to hereditary cancer risk management? And we asked it for a number of different cancers. So there were a couple of surveys, and each one had different questions about the different types of cancers that are most prevalent in our community. But across the board, the responses were very similar. And that was about 84% of you told us that no, you had never been told about your risk management research options from a healthcare professional. The second question in the second pie chart on the right, we asked, are you interested in participating in research related to hereditary cancer risk management? And you can see it's almost the opposite. 75% of you said, yes, you're interested, and only a quarter said no. So there's a real mismatch here between interest in participating in research and our community and other people with inherited mutations being offered the opportunity and awareness of research studies. So this is just one of the many barriers to hereditary cancer research, and there are more. Some of the other barriers that we see are most people aren't informed about studies by their healthcare professionals, which is one of the reasons why we try and bring you studies in those newsletters on our website, in these hereditary cancer updates. I know that you're constantly being bombarded with research opportunities, but we are trying to fix the issue that most people aren't hearing about it. And, not everyone can understand the technical jargon that's in these research studies. They're written in complicated words that we know many people in our community don't understand. And, that makes it intimidating. And if you can't tell what the study's about, then, you have to go through a lot of studies with a dictionary in hand to try and figure out, am I eligible and would I even want to enroll? And then we know participation requires commitment of time, effort, cost, and, for some of these studies, risk. And so we know we have a very altruistic community. We know that you have told us time and again that you really want to participate because you see the benefit for ourselves, for our relatives. But it still requires commitment. It requires traveling. It requires, there's costs involved and, effort and time. And we know cancer prevention studies can take a long time before we ever get answers. And so sometimes, even if you're participating in a prevention research study, for example, you may still need to do the screening and prevention that the guidelines say that you should do. So, that's another burden too. But the most important thing is this: if we can't complete enrollment of these studies that can't complete enrollment close early. And oftentimes they close early without us having any conclusions, any results. And that's a waste of volunteer and researcher time, money, risks to making medical advances, and risks to lives. So enrolling people in research is critically important, and it is one of the areas that we focus our time on. So this is our site. And this is actually the live site. And if you go to the Force homepage and you click on research, you see the search and enroll tool is the first button there. And this is our database. That's a custom database of studies that we've curated that are focused on the types of things that people with inherited mutations would want to participate in. So some of these are treatment studies, some of them are prevention, some are quality of life, some are surveys. We have curated high priority studies and written them up for you in plain language so that you guys can access these studies, share them with your healthcare professionals, and hopefully enroll. So these are some of the cancer screening studies that are on our website, and we have several. Wisdom is a breast cancer risk-based study, so it offers MRI and mammograms based on people's genetic test results. Thank you for fixing that. And so it does include genetic testing. So if you have relatives who want to get tested but don't know how and they're interested in participating in Wisdom, Patrol is a prostate cancer screening study for people at high risk for aggressive prostate cancer. Precede is a study that I'm personally in, and I know many in our community are. This is a pancreatic cancer early detection study. And this is a QR code that takes you to the prevention studies on the FORCE website. And we have some cancer prevention studies as well. You can see just a few here. The one on the left is a vaccine study looking at Lynch syndrome and cancer prevention, this very popular study. Risk reducing salpingectomy, so removal of the fallopian tubes with delaying removal of the ovaries. We actually have a couple of studies that are looking at that in the FORCE database. And then another study for Lynch syndrome looking at colorectal cancer prevention with naproxen, which is a anti-inflammatory drug. So this is the QR code that goes to our screening and prevention studies. And we hope you will enroll. And that's all I have for today.
Excellent. Thank you so much, Sue. I'd like to thank all of our four speakers. We're now going to move into the Q&A portion of the presentation. So I will ask all of our speakers to come on camera and bring their mics online. We'll be taking questions from the chat, and I do want to start there since we do have a couple that have already come in. So this first question is for you, Sue. We have a attendee who is asking, is there a chart that shows percentage of getting colorectal cancers with Lynch syndrome? Is there a vaccine available? Not. Or studies on the vaccine in the studies done yet? When will it be available to everyone?
Those are great questions. So we do have charts on our website that talk about all of the cancer risks based on the latest NCCN guidelines for each of the Lynch syndrome genes. They're all a little bit different. So I do encourage you to go to the FORCE website to find that information. And you can email us at info@facingourrisk.org. If you can't find it, we're happy to direct you to it. As far as the vaccine studies, I actually happen to show one of the vaccine studies that we have that we're promoting. There are a few, to my knowledge. None of these have reached the level of FDA approval yet. I think they're still in the fairly early phases of clinical trials. There's also been a couple for BRCA, and the situation is very similar. They're not yet approved, but the clinical trials are ongoing and encouraging.
Excellent. Thank you. Excellent question. We're getting a lot of questions coming in specifically about mutations like ATM and if we are going to add additional types of cancers to the website. What I'm going to say for people asking those questions, we will absolutely follow up with you individually to let you know that our education team, what they have on the docket and what changes will be coming to the website. I did want to ask you this question, Lisa, specifically around policy. Why does FORCE advocate for laws covering specific cancer screenings instead of all the screenings for high-risk individual needs?
It's a great question. And in the perfect world, we would advocate for coverage of all the services that members of our community need, including full coverage of multi-gene panel genetic testing, if that's appropriate, as well as all the downstream care, including high-risk cancer screenings and risk-reducing interventions. However, the reality of how our health system is set up and the political system, sometimes it's easier to get things passed in smaller chunks. So we might have a lawmaker who is personally affected by breast cancer and wants to sponsor a bill related to breast screening. And so we will take advantage of that opportunity to have an incremental impact. So we are passing, there have been a few state laws that are more comprehensive and aim to cover all of the NCCN guideline recommended cancer screenings with zero out-of-pocket cost, which is fabulous. And that's our dream bill, our dream law. But in the intervening time, if we can pass a law that'll help eliminate out-of-pocket costs for prostate screening or other types of interventions that our community needs, we're going to take advantage of that, and then try to add on to it as we move forward. But great question. Thank you.
Excellent. Thank you, Lisa, and thank you for all of your work in this space. I do want to flag us that we are just about a minute over here. I wanted to let everybody know, asking the chat, that yes, this is being recorded. It will be added to our website. So I do want to continue and make sure that we are answering the questions in the chat. I'm going to consolidate a couple of them, Puri, because really they're directed towards you and they are asking, where can I get more information? So if you could just take a moment to explain in depth how to access the blog on our website. And then this is a two-parter for you because that's the first part. And then the second part is asking about multi-gene panel testing. What is it? What types are available? So two parts for you there. First, about the blog.
So to access the blog, you would, of course, go to the Force website, and under resources, you'll see the X-ray program, and adjacent to that, you'll see the blog. So if you click on the blog, it'll take you to a page that has all the blogs listed, and we are using a common photo with the different genes. So you'll be able to kind of scan very quickly to see, if the gene that you're interested in has been covered in a blog. And also in that introductory blog that I showed you, we will include new genes as they are posted in that introductory blog. So you'll be able to go from the introductory blog to a gene of interest.
Excellent.
I
do just want to point out as well, if you are signed up for our monthly newsletters, in those newsletters, we also caption and highlight specific blogs that are being featured. So that's a good place to check as well. Just keep checking your inbox for all of the news that Force is giving you. And then Pira, I think you were going to start on the second part of that question.
Yeah, so way back in the day when we used to sequence hereditary cancer genes, we do it gene by gene, and it was very, very slow, labor intensive, costly. And over the last decade or so, recent advances in DNA sequencing technology have increased how rapidly we can sequence genes and how the cost has decreased significantly. So now multi-gene panel tests can screen for over 100 genes on some of the panels, over 100 hereditary cancer genes on some of the panels. So some panels may screen for, 10, 15 genes. Other panels screen for a lot of genes. And that way you kind of get, a broader information about what hereditary cancer genes may be in your family. And I saw a question come through on BAP1. It just so happens that I'm almost ready to post a blog on BAP1, so stay tuned.
Excellent. Thank you so much, Piri, and thank you for updating us on what is upcoming. Kelly, I'm going to bring this question to you because it's about treatment for BIA-LCL. And we also had a question come through about once there is explant, what are the risks of recurrence? Could you speak to those two questions?
I will do as best I can on that. Yes. So treatment is initially is about diagnosing whether it is BAL, CAL versus other things like capsular contraction, which are more common. And that is typically done by some initial imaging and then ruling out some other issues. But if they do think it is this lymphoma, then the procedure is to surgically remove the implant and the capsular area around it, any scar tissue that's built up, and look at the margins of that to see if there's a clean margin, typically to look at the surrounding lymph nodes to see if there's been any spread there. If there's not, then there's typically just watching by surveillance to make sure they haven't missed anything. I mean, that's the vast majority of cases of this rare lymphoma. In cases where the cancer wasn't completely removed by the initial surgery, or there's lymph nodes that are positive, they'll go back with radiation and chemotherapy potentially, and that's in a much smaller percentage. I think the numbers are so few There's been, I think, reported to the FDA since 2011, there's been 1,300 plus cases. So, and that's total in the US, whether it's cosmetic or reconstruction breast implants. So there's not a lot of cases to really know what the recurrence rate is. But I don't know of cases where that's been reported. And I can't say that there aren't any. I haven't particularly looked for that, but it's pretty rare. So.
Okay. Excellent. Thank you for answering the question, going back to your presentation, providing more information on it. We are going to wrap with questions at this time. If your question was not answered, we will follow up with you individually with the presentation. Again, I'm going to tell you that this presentation is being recorded and will be uploaded to our website, the Hereditary Cancer page on Force's website this week. So if you missed anything, came in late, would like to go back and revisit, it is all there. I would like to take this time to thank our speakers so very much here on the Force staff for doing this update and bringing you this hard-hitting news that keeps you abreast of everything you need to do to remain to keep yourself empowered. So thank you very much, speakers, for this presentation today. And just to wrap up, I just have a few more slides and resources that I would like to share with you before we depart. And so this is a perfect opportunity just once again to thank our sponsors to help to bring this programming to you. What is on the horizon coming up besides what Piri mentioned about their great blog articles coming up? We have a number of exciting events. So we will host our next Ask the Expert webinar on breast cancer risk screening prevention on August 28th at 5:30 p.m. Eastern Time. And our next Hereditary Cancer update will be held on September 25th at 2 p.m. Eastern Time. You can use these QR codes to register, but also information will be coming out on our social media platforms and to your email. Lastly, please continue to reach out to Force for your support and information needs. Visit our website for more information, and please take the time to fill out our quick event survey using this QR code. Your feedback is very important to us and helps to shape the future of this programming. I will leave this slide up just for a minute in case you do want to click on that QR code to fill out that survey. We'd be very appreciative if you did. So all this to say, while there are many mutations and many cancers, there is just one community, the Force community, that supports anyone who is impacted by them. Thank you very much for attending and have a good day, everyone.